Good morning, and welcome to this week's Grow, where we gather to recharge, organize, and work here as members of MWEG. We're so glad that you're joining us today. We have Annie Bentley-Waddatz, who is our Senior Director of Strategy and Director of Advocacy for Children and Families. And we have EJ Johnson, who is a consultant, a project consultant working with Annie on this global health advocacy area that we are working on and talking about today. And this is something new that MWEG, project that MWEG is going into. So I'm going to let Annie explain more about that and some connections that we have with the Relief Society, and let her fill you in.
Great. Thank you so much. Yes, it is my pleasure to be here today. This is something that we've been thinking about and pondering ever since, as many of you may know, back in June of this year, but really for quite some time, the General Presidency of the Relief Society of the Church of Jesus Christ of Latter-day Saints launched a global health initiative that was really focused on humanitarian work for women and children. And it included a $55 million grant given to partner organizations around the world to work collaboratively and address these issues around the world. And along with that financial commitment, what caught our eye and our ear was the Relief Society leaders also issued a call for LDS women to engage with this issue in the world and in their communities. And at the time, Camille Johnson said, "We strive to care for those in need by engaging in humanitarian efforts, which have the greatest possible impact." And Sister Kristen Yee said, "When we see a need, we step in and bring people together to help solve problems and to meet needs within our own sphere of influence." And so thinking about that, thinking about how we can respond to that invitation as members of MWEG, and how we can care for those in need by engaging in efforts that have the greatest impact and responding when we see a need, we decided that adding this initiative, this global health initiative, to our advocacy efforts would be a beautiful way to kind of align ourselves with that invitation. And at the same time, there is a great need in the world. And I will just pause for a minute and say, when we're talking about global health, at MWEG, we're thinking about domestically and internationally, thinking about how we make sure that children and families are thriving physically, and that those are that health is the building blocks for thriving emotionally and spiritually and civically. So we wanted to answer that call and really emphasize that policy work, as we advocate for good policy and funding policies around the world for this health, is really complementary to the humanitarian work that the church does. The definition of a humanitarian is that they assist people in extreme need and reduce human suffering and create conditions for well-being and self-reliance. And so we can be humanitarian advocates. We can be advocates who are helping to assist people in extreme need by speaking up to our leaders and asking them to continue to fund things that will bring better food security, disease prevention, and thriving around the world. Another reason why we're moving into this area, or providing this opportunity for people to move into this area as they so wish, is that it touches on many of our advocacy areas. Global health, of course, intersects with the movement of immigrants around the world. And so the immigration issues and advocacy and health touch each other all the time. Same with supporting children and families, which this initiative, that's the umbrella for this initiative. Same with rooting out racism and protecting democracy. All of these things are influenced by and touch on global health. Another reason is it gives us a really wonderful opportunity to work with on an interfaith basis with other religious and faith-based organizations doing this work in the world, doing the advocacy work to speak up and ask our leaders to care for the most vulnerable and the neediest, and to think about at the same time that disease knows no boundaries, and that, you know, as we advocate for disease prevention on the other side of the world, we're also advocating for that here. But what's wonderful is as other groups are doing this, we can join hands as members of the church to show up and advocate alongside our other brothers and sisters in other faiths. I I'm delighted to introduce EJ Johnson, who's going to talk a little bit more about global health. EJ has just joined MWEG, working as a project consultant, managing this project, and has a deep background, some really great knowledge that she brings in global health. We're really delighted to have her, and she is in the DC area, which is also a great place to be as we're doing this work. EJ, I'm going to give them a little background about you, EJ. She graduated from BYU and then just completed a master's degree from the London School of Economics in health and international development. And so she has the passion and the knowledge to help guide us through some of these issues and help us understand what might be coming up on the radar in the coming year or so that we can advocate for that would concern global health. So I'm going to toss it to you, EJ. And then as EJ talks, if you have any questions, bank them and we'll turn some time over to you.
Awesome. Thank you. I'm going to share my screen now for some slides on global health. Thank you so much, Annie, for the introduction. So just to start out, the World Health Organization defines health as a state of physical, mental, and social well-being, not just the absence of infirmity or disease. So I think that's a great starting point. It kind of ties into what Annie says, that health is really a broad issue that's affected by a variety of things outside of just being well or sick. And so global health is really important because it does impact everyone. Like Annie said, health knows no borders. And as society has become more interconnected, the health of humans, animals, and the environment really affects the well-being of all people, not just people in one area of the world. And so the US has a strong interest in promoting good global health, and their efforts aim to improve the health of people in developing countries and our own country, advance global development goals, support foreign policy priorities like democracy and improving human rights. A lot of the US grant funding is kind of dependent on whether or not a country is willing to implement these other things in addition to supporting good health, and then also addressing national security concerns. As you could see with like the COVID-19 pandemic, with the spread of disease across borders, that can cause lots of other issues and economic instability that we want to avoid. And so global health really is interconnected with all of these other issues. And when it's good, it can improve both like the health and economic well-being of every country in the world. So there are a variety of reasons why global health is important. The first one is disease prevention and control. So it's really important to deliver interventions for diseases. Some of the big ones are malaria, TB, and HIV/AIDS, but also with the pandemic, we can see with like upcoming diseases, I guess, being able to have the technologies to stop the spread of disease is really important. Improving maternal and child health is a big priority in global health movements worldwide. So reducing maternal and child mortality by improving birthing practices and access to prenatal care, and also information on breastfeeding and nutrition afterwards. Strengthening health systems is a priority. providing preventative care so that people aren't having to deal with the after effects of diseases, but are able to prevent them from becoming large-scale issues is really important. And lots of grants strengthen health systems, and then those can be used for other areas. So, for example, funding for HIV/AIDS improved health systems in a lot of countries. So during the pandemic, they could use those health systems to address other disease areas as well, which is really cool to see how they build on each other. And then also emergency response, so dealing with outbreaks is really important with global health. And then in addition to these specific health issues, improving global health can also improve economic development, because when you have a healthy workforce, people are able to contribute to the economy and be more productive overall. And then also global security, which kind of ties into all these things, but we don't want these global disease threats to spread across borders and cause other issues. Oh, let's see, there we go. So some of the key health programs that the US is involved in are, this kind of Venn diagram shows all of them, but the top three that are funded is PEPFAR, which is the President's Emergency Plan for AIDS Relief, I think is what it stands for. But basically that's funding for HIV/AIDS. The Global Fund to fight AIDS, malaria, and tuberculosis, and then maternal and child health. And then you can see there are all these other categories. So like global health security, malaria, family planning, neglected tropical diseases, et cetera. So all of these are kind of the main areas that the US is focusing on, but these are the top three. And a lot of people think about global health as kind of this expense that's really taking a toll sometimes, but foreign aid only accounts for about 1% of the US's annual budget. So it's very low, and global health is a part of that. So although this is a lot of money, it really is doing a large amount of work and has a large impact for a pretty low budget cost. And these are just some of the impacts of this health funding. So for PEPFAR, the HIV/AIDS fund, they've saved 25 million lives. 5.5 million babies were born without HIV. 64.7 million HIV tests have been administered, and 7 million orphans and vulnerable children have been cared for using just that funding. The Global Fund to fight TB, malaria, and AIDS, they've saved 59 million lives, reduced the death rate of AIDS and TB and malaria by 61%, which is pretty amazing. Have expanded access to antiretroviral treatment, which is AIDS treatment, for 25 million people, and then treated people for TB and distributed mosquito nets as well. So just a massive impact. And then with maternal and child health, they've also been able to save 7.4 million lives, decreased under 5 mortality by 44%, maternal mortality by 42%, and have trained millions of healthcare workers to help with child health and nutrition, and also helped people gain access to drinking water services and better nutrition. So these are just three of the many programs that are funded, but you can see just the enormous impact. And I mean, collectively, it looks like they've saved like 90 million lives just in these three programs. So they're really essential. And when we improve the lives of other people, honestly, it does just improve the health of the world and our interactions with other countries. And so it's just a really important issue. And this next year, PEPFAR, the AIDS funding is up for reauthorization. So that's probably something that's going to come up, just advocating for that renewal, because it has just made an enormous difference in the spread and control of HIV/AIDS, especially in Africa, where it's still a pretty large health concern. So I'm going to toss it back to Jessica. Is that right?
Back to
Rachel.
Annie or
Okay.
me.
Yeah, you can
That's
toss it to me. Yeah, so I wanted to add a couple of things. In case you joined us a little bit late, we're just giving context to this new initiative where we, under our children and family advocacy, we've decided to add a global health initiative. And as EJ was talking, and because of a couple of things that we've been talking about, what comes to mind is the because I have been given much. And I think, sometimes the argument is, well, there's a lot of need here. Why help people around the world? And I think that members of the church are uniquely positioned to understand firsthand, because of our mission programs and because of other ways that we're able to actually personally witness the need, the extreme need that exists in places around the world. And so I think it's a wonderful matchup for our MWEG membership, for those who are interested in this issue, for those who feel strongly about it, to be able to advocate for it. I was just hearing Emma talk about this a couple days ago. We have lots of opportunities and invite people among our membership to engage in different ways. And we don't expect everyone to engage on every topic in every way, but do feel this awareness and this almost need, this, we feel compelled to make sure that we do offer the opportunities to be heard and to connect on these issues, for those of you that are willing to do so. We will, in the next little bit, as EJ said, we're going to do some more learning and some more sharing about PEPFAR. We're going to be, this coming year, talking about food insecurity and nutrition, and looking at both domestic and global policies and programs that we can support, that we can join our voices in asking for that assistance around the world. And as I said, I just think this is such a beautiful partnership to humanitarian aid, to giving, to donating money. We can also donate our own influence on our political leaders to speak up and advocate and affirm these very bipartisan, traditionally bipartisan, well-accepted, well-researched, impactful programs. We're entering kind of a time of uncertainty, and there's a possibility that there's going to be some confusion about health facts and and we don't want to see that be weaponized. And so we're sort of in advance making sure to raise this issue and help us be clear about and to be clear voices in the world about the impact that they can have, and through our advocacy, and ultimately Congress passing these kinds of bills. So I'll pause for a minute just to see if you have any questions, comments. You can put it in the chat, you can ask a question out loud. One thing that I'm thinking about and wondering is whether we can access some of the mission leaders, that might have served in some of these areas that are affected by some of the funding, like PEPFAR, how we might build kind of a coalition of women who have done some work in public health or feel, have been able to serve as witnesses. So if anybody has people that they know, let us know, that so we can kind of reach out, and as we build our op-ed library and the team around working on this.
Yeah, and Annie, I would remind everybody that if you want to make sure you're receiving information on children and families and this World Health, that if you are in MWEG Central, there are spaces you can I want to say subscribe to, but it's you join that space in MWEG Central specific to the areas of advocacy that interest you personally, and then you make sure that those will be in your feed, and you'll get that information so you don't miss anything. So that's just one more plug for why MWEG Central is so great, so that you can kind of tailor it to what areas of advocacy are most interesting to you. But this and I enjoyed Annie and EJ, as you guys were talking, how the areas of advocacy that MWEG has been focused on, how these all kind of interconnect with immigration and caring for creation and our rooting out racism, all of those together with our children and family, and then just our protect democracy of making sure that our representatives are listening to us. It's easy, like when PEPFAR comes back up for a vote, that we encourage our representatives to support that bill so that it can continue to do good around the world. So I'd love to see how that all goes together. Does anybody else have any questions? You're welcome to unmute and just ask. It's There's nothing formal about it if you have questions about it. Doesn't look like we have any questions today.
Oh, it
Can
looks
I
like
ask a
Laura
quick
might.
question?
Okay.
Mhm.
Yeah.
So with this,
Oh.
I'm sorry, I've been
Two
in
Laura's.
MWIG for a really long time, but I haven't been very active in it, and so I'm just increasing my activism. And so I don't know exactly like the structure. Would issues of homelessness fall under this, or is there a different group that's kind of dealing with issues surrounding homelessness? That's just an issue I've been personally researching and reading books about and trying to understand those issues better.
That's so great. We this homelessness doesn't necessarily, but again, as you might imagine, health and public health and those issues do impact homelessness. And we don't have a separate group that advocates around that. We do have a lot of members who do good work in that space and who volunteer their time. And so there's a number of ways. So if I'm going to take down your name, Laura, and connect you with a couple of people, but we were reminding last night we had a call with our sustaining members, and I really loved Emma emphasized and invited people to use their MWEG skills and to use some of our tools that we have to do some of the advocacy in the world if we aren't like focusing on that at the moment. And so there's a call to action tool, a letter writing tool that is available to members all the time that will, if you enter in your state and your address and then write a letter, it will shoot these letters off to your representatives on the federal level. But also just stay tuned, because I think there will be ways that we can speak to those issues kind of alongside each other. I don't know if you have additional anything to add to that, Rachel.
No, it looks like Laura has a question or a comment.
Laura Lowe. Yeah.
So I have been a member for a long time, but lurking and too busy and all this stuff. But I recently have gotten to know a friend who has a background just like EJ's, actually, degree from BYU, master's in health, and her specialty is doing research into specific issues like maternal health in Africa. I mean, and she just moved, and we just reconnected after her move, and I'm so excited because I'm thinking she might really have some skills that would be useful. And I'm such a dope on the whole maneuvering and navigating through the MWEG site. I might need to contact somebody to say, is this the right thing to tell her? I told her about MWEG last week, and she sounded really positive. And then I'm going to contact her again in a little bit, and I will send her something. But is it okay if I fly it past somebody to make sure that what I'm telling her is correct about how to sign up for MWEG in such a way that she doesn't get overwhelmed with a flood? Because apparently 6 years ago or however long ago, I signed up for everything. And like, there's been so much MWEG. It's like,
yeah.
So now I'm going to be intelligent. I'm going to act like a grown-up about this, but I might need some help.
Yes, and I would
So,
encourage her, if she signs up and goes into MWEG Central, to do her settings so that she doesn't feel like she's getting notified and everything about every certain little thing, because then it does feel like a fire hose of information, because you're getting emails and information about everything all the time. But that's great that you invite her, and you can share the link to this grow also, and share that with her. Our grows are public. They're on our YouTube channel. And once you go there, you can go to YouTube and search Mormon Women for Ethical Government, and you can find the playlist of grows and share any of the grows and go back and watch old ones and share them with your friends.
Ooh, wonderful. Thank you. Yeah.
And then I see, Liz, you popped up on the screen. Do you want to also connect with Lara and let her know how to?
Yeah, Lara, send us an email at info@mweg.org. We have super helpful gals who will be happy to read over your message and give you some tips on how to reach out to a friend and other things that you can share. We would love that.
So it's info.
Or who was it I should send it to?
The email would be info, INFO, at mweg.org.
Okay. Okay.
And that's kind of your one-stop shop phone a friend email address if you are ever stuck.
Okay.
They can help you out. Yeah.
I don't see any other questions or hands. Well, I want to thank Annie and EJ for sharing this information. We're excited that we get to be part of this global health initiative, that we get to partner with so many great organizations, and we look forward to seeing what MWEG can do to be players in this space and to support these initiatives. I would invite all of you to join us next week if you are interested about the recess assignments for the upcoming administration's cabinet. We have our Director of Protect Democracy and Advocacy, Jessica Larson, who's going to join us next week on the growth. So we would invite you to all come back. And so thank you so much for being here. And you can find the recording on MWEG Central or on, like I said, MWEG's YouTube channel. And I will post it there later today. And we'll see you guys all next time.
Thanks. Great to see you all here.